Good morning. Good morning. All right, indulge me for 1 minute. Can you be upstanding? Thank you very much. So there is this nursery rhymes that my daughter is learning recently, and she's learning it in Yoruba. She calls it Nigerian language, by the way. All right, so we're going to sing, and we're going to do the same. So it says head, shoulder, knees, and toes. Are you ready? Yes. Okay, so head. Okay. Shoulders, knees and toes. And shoulders, knees and toes. Come on, some people are not even making effort. One more round. If you're not making effort, you stand with me throughout. There are some people I cannot look at their faces while I'm saying that, but get it. All right, one more time. And shoulders, knees, and shoulders, knees and toes. Knees and toes. Shoulders, knees and toes, knees and toes. All right, give yourself a big hand. Thank you very much. Professor Damifer, thank you. I should have brought your house to model for me. So, I'm sure you're probably wondering why are we doing that? This morning we're talking about hypertension and diabetes, and doing that basic exercise is so important in diabetes and hypertension, in our day-to-day life, really. I understand we are very busy. I understand that there are so many things that we have to do, but that consciousness that it could be something as basic as just singing the rhyme that doesn't even take 30 seconds or 1 minute. And if you do that 5 times, you've done something. I know it's not up to the recommendation of 30 minutes, 5 times a day of brisk walking, but it's better than sitting down and pressing our phones and while we eat our big bowl of swallow. That's what we do, isn't it? That's what we do. All right. So hypertension and diabetes. Popular prayer when you say somebody has hypertension is that I remember we were talking about it, and she was saying that the popular prayer is God forbid I cannot have hypertension, or God forbid I cannot have diabetes. How many of you have prayed that prayer? Yeah, I agree. God forbid. God forbid. You know, I'm one of the people that take my confessions very seriously, but I also, learn, at work, randomly, I just go to colleagues at work and say, can you just check my blood pressure? My blood pressure is perfect, 110/70, low for my age even. But from time to time, in the peak of work, I just want to sit down and get it checked. From time to time, in the peak of work, I just want to say, can you just check my blood sugar? Not because there is anything I'm afraid of, but just because it's that consciousness, just have it checked. Very recently, I noticed I was getting, common cold like almost every month. So I told my colleagues at work, book me in, do me a blood test. Let me just see what's going on. I'm confessing my scriptures by the stripes of Jesus, healed, but I'm also getting it checked. Do you know why? It's very difficult for me to balance being a pastor and being a doctor. But it's important to say this. The reason I'm saying that is, let's say, for instance, Bible says that Christ has redeemed us from the curse of the law. When, if there is any diagnosis, you can take it back to God and say, this one is the diagnosis. Heal me of it. But if you don't know, unfortunately, it is late because there is complications. And at that time, it's difficult to even have faith because one is struggling. Okay? Okay, so that's the part of it's done. Amen. All right. Hypertension and diabetes. Thank you. Reverend Irene, for this opportunity. Thank you so much. And thank you, Reverend Tony, for teaching us about autism. I've heard you talk about autism, but this was different. Thank you. God bless you. All right, so diabetes. I'll start with diabetes. I'll try and talk about both of them side by side. What is diabetes? Does anybody know? Diabetes. Not enough or too much? Too much. Too much. No. No. Diabetes is always too much. Yeah. Diabetes means that the blood sugar is too much. However, what you're saying is there are different kinds of diabetes. There is type 1, which means that the insulin. Uh, so it's the insulin, it's autoimmune system or autoimmune disease where the body does not have enough insulin. That is type 1. Type 2 is when there is insulin, but the body is not responding to it. Okay? Then there is something called gestational diabetes, which means that somebody has too much blood sugar when they are pregnant. For most people, that gets resolved after the pregnancy. But unfortunately, that also increases their risk of having diabetes later in life. And then there is something called pre-diabetes, which I think is so important to emphasize. Pre-diabetes means that the blood sugar is too high, but not high enough to be diagnosed as diabetes. So they also call it non-hyperglycemic diabetes, but that also increases the risk of having diabetes. And hypertension, on the other hand, have you heard about hypertension or high blood pressure? Yeah. So blood pressure basically is essentially it has to do with the pressure that is needed to maintain blood flow through the body. So the heart is trying to pump the blood. Um, the heart is like a pump, and then there are blood vessels, so small vessels taking the blood out of the heart. So that balance of the pressure, it really is blood pressure, and different things happen. So the size of the lumen, the size, which is the lumen, the size of uh, the arteries, other conditions present, all of that affect, the effectiveness and how high or how low the blood pressure would be. So in terms of the blood pressure, when you do a reading, you find two readings. One is the top one, and then one is the lower one. Good blood pressure, good blood pressure is 100 to 120 for the top one. And that top one is the pressure of the heart against the artery when the heart is pumping. And then the lower one is the pressure when the heart is relaxing. So good blood pressure is 100 to 120. However, that can be extended up to 140. And then good blood pressure for the diastolic is also say 60 to 80. But again, that can go up to 90 to be fair. Now, high blood pressure is diagnosed if one has blood pressure above 140 over 90 in two clinic settings. So, for instance, if you come to my clinic and I see you and I take your blood pressure reading and it's higher than 140 over 90, that's one reading. Two is, you then check again say tomorrow or in a different setting and it's 140 over 90 or above, we can say you have high blood pressure. There is a provision to that. The provision to that is that some people have something called white coat syndrome, which means that their blood pressure is high whenever somebody says blood pressure or whenever somebody says, oh, let's check your blood pressure in a clinical setting, their blood pressure goes high. Now, what we do for people like, in fact, most of the time, I don't diagnose hypertension in one setting. So if I see you now, except your blood pressure, of course, is 180 or 200, then, well, sorry, that's too high. But if your blood pressure is around 140, 150, what I do is to ask you to do something called home blood pressure reading or home blood pressure monitoring. And what that does is you are doing it in your own setting at rest. So typically, I would say, for instance, check your blood pressure first thing in the morning. By the way, how many of you have blood pressure monitors at home? How many people? So it would be nice to have. It's £10 on Amazon. You don't have to buy the hospital grade. Simple, basic one. Yeah, but buy something good enough as well because sometimes low grade means worry. So buy something good enough. But going back to what I was saying, so you check first thing in the morning before you do anything. So you've woken up, you've prayed, check your blood pressure. Last thing at night when you're very relaxed, check your blood pressure. And you do that, you can do two readings. So again, do two readings, three readings in the morning, two readings, three readings at night, and write down the lowest of them. And then you can do that for 1 week. Yeah. So if the average of that over that 7 days period, if the average of that is more than 135 over 85, then we worry that this is indeed high blood pressure. Do we get that? Okay. Now for diabetes, there are different ways of checking blood sugar. Now the most common way is something called HbA1c, which is the blood sugar control over a 3-month period. And the reason for that is that some people have developed the tactics of not using their medication. And when it is time to go see the doctor, they start loading the medication and they stop eating. So that, if you check my blood sugar now, it's probably going to be low because I've not had something to eat in last night. Yeah. But if I've just eaten my bowl of pando yam with plenty vegetables, then my blood sugar is going to be high. Yeah. So the reason for HbA1c is it tells you control over 3 months. So if HbA1c is more than 48, then that's diabetes. But there is also symptoms, which I'll talk about in a minute. Yeah. So fasting blood sugar, which is the one that you can check if it's more than 7 and you're having some symptoms. Or random. Random means that at any time we are just sitting down and you check it, it's more than 11 and you have symptoms, then that makes you worried of diabetes. What are the symptoms of diabetes? Yeah. First thing, commonly with diabetes is that I've mentioned that there are two types. So one is type 1, which can easily be diagnosed, again, commoner in children and young people. And I want to say this, unfortunately, diabetes can also be diagnosed in children. Diabetes is not just something that is for adults. So there is type 1 diabetes that can be diagnosed in children. So for the symptoms, there are things like passing a lot of urine. So some people it's urine a lot. So if you're passing more urine than usual, it's something to think about. Or if you're feeling thirsty, so some people all of a sudden they notice that I just feel like drinking more and more water, or I feel like eating. Sometimes people feel like eating a lot more than usual as well. So polyuria, polydipsia, being thirsty, polyphagia, eating quite a lot. It's that those are common symptoms. The other things are if one has a wound that doesn't seem to be healing nicely, this thing is not going away. Get it checked. It's best to get it checked. Or say sometimes some people pass urine and it's very fruity, so it's foaming like that. This thing looks a bit different. It's something to also pay attention to. And then thrush is another important thing. Man, woman, thrush. So if you're getting recurrent thrush, or some people get recurrent boils or like infections, it's important to pay attention to that. So that's for type 2 diabetes. Type 1 diabetes, which can be found in children, most of the time does not come with a symptom. Most of the time, it's an emergency. The person is just suddenly very unwell, vomiting, abdominal pain. Sometimes somebody just has abdominal pain and you cannot explain it. It's because there is ketoacidosis and that is an emergency and they need to be seen urgently. But the other thing is weight loss, which is more common in type 1. So if people are losing weight, anybody losing weight randomly, then we need to think about diabetes. So I'll just run through them so that I think those are the important things. Um, passing urine too much, feeling too thirsty, drinking too much water, eating too much as well. Infections, recurrent infections which are unusual or thrush, that think about that. And then for blood pressure, now the trouble with hypertension is that typically it's in fact it's called silent killer, because I have seen people who the first time they knew they had high blood pressure was they had health check. This is very common with people that do like they are truck drivers, or people that actually need to have their head checked. They are the common people that have this trouble. One day, I was just there in clinic and somebody came with a note from maybe the pharmacy or from the head check, and they said his blood pressure was 200 over something, and he doesn't have symptoms. He doesn't have any symptoms. So for most people, we feel very fine. You feel 100%, but your blood pressure can be more than 200. That's why you're checking. Yeah. Some people get symptoms, headaches, changes in their vision, but when you are getting to that point, it means that certain complications are already settling. Yeah. So how many people will check their blood pressure today? Okay. Tomorrow, when you buy your monitor. No, but again, all of this is a waste if you don't check. There is no the reason Reverend Kamea said to come and talk to us about it is so that we can make those changes. There is no point. This is not to make you scared. This is not, put God's word in your mouth, but also check your blood pressure. Yeah? Do we have a good agreement? Yeah. All right. Thank you. So flap your hand like flap, not clap, flap. Okay, thank you. Everybody's awake again. Good, good, good. All right. Now, who are the people that are at risk? Because that's also very important. Who are the people that are at risk? So when you think about hypertension and diabetes, certain things are common. Race, race is common, race. So either it is genetic predisposition, or the fact that our our cultural, so certain things are cultural, the food that we eat, the way we think about things like exercises, for instance, the way we do our things, either it is because of that, or there is a genetic background. Personally, I'm not sure, but definitely race is important. And so for hypertension, for diabetes, people that are of the African, Afro-Caribbean descent, people that are Asians, they're very top on the list, as with quite a few other medical conditions as well. Diet, what do we eat as well? So LD diet, they call it, for blood sugar, processed food, for hypertension, too much salt would raise blood pressure. Again, weight. So being on the big side of our weight also increases the risk. For things like diabetes, like I mentioned earlier, gestational diabetes, which means having raised blood sugar in pregnancy, increases the risk. Being pre-diabetic also increases the risk as well. Uh, I think those are the common things, but particularly race. And the other thing I need to mention is that being hypertensive increases your risk of being diabetic, and being diabetic increases the risk of your being hypertensive. And the correlation, how that happens, for instance, is that one, we've talked about the common things like both of them being race and diet related and physical activity related. So those are some of the things. Two is that the processes. So for instance, being diabetic means that the lining of the blood vessels get easily damaged. And when I was trying to explain earlier, is that there is a pressure. So there is the pump, and then there is the pipe that is carrying it. So anything plugging. So think about your water pump and the pipe taking water. If anything is clogging that pipe, you need more force. to push it out. And that's what happens. So diabetes damage the lining of the blood vessels and it becomes more difficult for the heart to pump and vice versa. So, the for instance, in the type 1, when there is type 2, when there is resistance, the bloody cells then try to stimulate certain nervous system, which also controls the blood pressure because everybody's trying to ginger themselves to say, oh, come and do more. Then blood pressure gets a bit more difficult to control. Medications, treatments. We know there are treatments for these things, right? There are treatments for both of them, blood pressure, diabetes. Treatments are lifestyle changes. Yeah, not just that, but very essential that even if one was taking 10 medication for either of them, lifestyle changes are still like the bedrock of what you have to do. Okay. For type 1, whatever the lifestyle change is, it doesn't stop it because it's autoimmune. Autoimmune means that the body, for some reason, is fighting itself. Yeah, and certain people are predisposed to that. And so somebody with one autoimmune, typically you will check for other autoimmune because the body is just switching on itself for some reason, fighting itself. And so lifestyle changes helps maintain the symptoms, but doesn't necessarily stop type 1. But type 2 is more common. Type 2 diabetes is more common. So before you say, so why am I not eating my food? Type 2 is more common. People are more likely to have type 2 diabetes than type 1. So lifestyle changes, diet. If you go on British Heart Foundation or Diabetes UK, they have very nice information about diabetes, about high blood pressure, and they have good links to the British BDA, British Dietetics Association. So information about portion control, how much sugar, how much carbohydrate, and all of that, which are very good. So diet. Diet is very important. Exercises, like I've said, and like we demonstrated, it doesn't. I know you are busy. I'm talking to myself too. I know I'm very busy, but sometimes I've gone to places now where the good thing they've done is I can stand up from my seat to go and call the patient, and yes, it wastes my time, but I can just stand up and say, oh, call the patient, call the patient, call the patient. Imagine you do that 30 times a day, it's better than just sitting down calling them. So, again, that's just a practical step, simple stuff to start with and build it up gradually. Exercises. Okay, so I want to finish. How many more seconds do I have? 5? Okay, that's fine. So I think the important thing again is now we've talked about the things to prevent, but I think where the trouble then lies is that a lot of the times people then know. For instance, somebody you are listening to me and you know that you checked your blood pressure, you know it's high, but you just feel like that can wait. You just feel like I won't get the GP appointment. You don't even want to try. Please try. Get that appointment. And for some of us, what it is that they've given you. I've seen people. In fact, very recently, I saw a gentleman who was on blood pressure medicine and stopped. In fact, and this is not race based. This is everybody from every race, from every color. They just wake up one day and they feel like my symptoms are all fine, and they just stop taking their blood pressure medication or they just stop taking their blood sugar medication. Why? Because you feel like it. It's good. God can and God does heal 100%. You see, but when God has healed it, get the confirmation that your blood sugar is perfect now. Your blood pressure is perfect now. Don't just do it on your own. Some people, your blood pressure is still high and you're not taking the medicine because you cannot be bothered. It's dangerous. It's very, very, very dangerous. Okay. So if there are so many medications that help with blood sugar, There are so many medications that help with blood pressure. If, for instance, for Africans, they will probably most likely start you on something like amlodipine. Side effects of that, because every medication, some people like paracetamol, they take it every day. Yeah? Yeah, you're guilty. Don't raise your hand, just know in your heart. But even your paracetamol has side effects. There are people that cannot take paracetamol. So if you can pop paracetamol, then you can use amlodipine. If your faith, if your faith is not strong enough for you not to say my head, be healed, but instead you go to paracetamol, please use your amlodipine. I'm serious. I'm serious. Because look, amlodipine has side effects. Some people they have flushing, they have headaches, some people have swelling in their legs. But it's not just amlodipine. If that doesn't work, or if there are too much side effect, we can try something else. I have seen lists where people have tried 5 different medication until they get to the final one. Most people are not like that. There are chances that if just one does not work, something else would help. Yeah. So if the trouble is this medication is causing trouble, try something else. The reason I'm saying that is because there are complications, and that is what we don't want. Yesterday, I saw a gentleman who, from what I saw, had stroke. He was 49. He was 49. Stroke is a complication of hypertension. Yeah. Stroke. And do we know what stroke is? Anybody? Okay, stroke means that there is weakness on one side. It affects the speech as well. So most people, if they've had stroke, they struggle, they would need help with rehabilitation and all of that. So stroke is one major complication, but it doesn't stop there. It can affect the kidneys. It can affect, for instance, people get chest pain, can affect the blood vessels. Same with diabetes as well. Diabetes can affect the eyes. So there's something called diabetic retinopathy. It can affect, again, we've said it can cause blood pressure, high blood pressure, can affect the kidneys as well. So the disease from diabetes that can cause, blood issues with the kidneys. It can affect the nerves as well. Yeah. So all of these are, just some of the reasons why it's important for us to use our medications if you have, or make sure that you prevent this from happening. How to prevent is regular checkup. Lastly, I would say that if you are 40 years and above, there is a free NHS check for you. 40 years and above. Yeah, I know it's tricky to get appointments, but if you get an appointment, just ask, just check. To say, look, I'm 40 and above, and I just have my cholesterol checked. Can I just have my blood sugar checked?